Whenever we think about cardiac tamponade, the EKG finding which comes to our mind is electrical alternates. That's the alternating height of QRS complex, tall and short. That's seen in cardiac tamponade, but that's not very common. So, what's the most common finding in EKG in cardiac tamponade? It's sinus tachycardia, right? So, what is cardiac tamponade? That's the rapid accumulation of fluid in the pericardial sac, right? Now, that fluid is going to compress what? The ventricles and ultimately atrias, right? So, when it compresses the ventricle, that will lead to impaired relaxation of the ventricles. And that will lead to what? Less venous return, right? Now, whenever you have less venous return, what will happen to cardiac output? Less cardiac output. Now, what is cardiac output by equation? Heart rate times stroke volume. So how will body try to compensate for reduced cardiac output? By increasing the heart rate. That's tachycardia. So sinus tachycardia is the most common EKG finding in cardiac tamponade.